project was commemorating how many years has YWCA been in Greater Cleveland. So please put in the chat what you think. Open.
So we have 100 years as a guess, 50 years as a guess, 125, 150. I feel like I'm in an auction here.
All right, thanks for reading it out loud because I forgot you can't see the chat when you're sharing a screen. So we were founded as an independent nonprofit, although there's YWCAs globally. There are many in the United States. There are many in Ohio. And there is a national organization, YWCA USA. We were one of the first YWCAs to be formed right after New York. And we were formed 3 years after the Civil War ended. So 150 years was the right answer. That was my first job. They're like, our anniversary is in a couple months. Can you throw us an anniversary party?
Tell her what she's won.
My amazement, all the glory, all the glory. So yeah, so that was my first job. And then after the summit at the public auditorium, we, in several months, were able to be a part of a regional collaboration to declare racism as a public health crisis here in Cuyahoga County, which was a driving goal of the summit, strategically to use public health crises, that language and that legislation to advance racial equity. So I'm really proud of that first step in doing that work here locally. But as soon as the event was over, the position became available here at Norma Herr Women's Center to be the services coordinator. And a lot of people think my job title is volunteer coordinator, which is totally fine because most of the services that I'm coordinating are provided by volunteers, such as what Rose is organizing. So to Rose's question, most volunteers block off about an hour's worth of time, and we probably get through about 40 minutes of content. It used to be more perhaps before the pandemic, but seeing as everything's virtual now, and since physical distancing goes against all of our normal routines, I do have to spend a lot of time managing distancing people who walk in the middle of the event. I'm like, oh, I'm sorry, you can't sit there. Let me move you over here. And making sure people can put their masks all the way on their face and stuff. I'm like, oh, hold on, everyone, your noses, you know, it doesn't work unless it's covering your nose as well, unless you're one of those people who is only a mouth breather. So Norma Herr Women's Center has been around for longer than the longer than the YWCA has been managing it. We've been managing it almost 3 years. It was called Norma Herr Women's Center before YWCA took it over. It is not its own nonprofit, which is why when Pat said if you're making donations, you want to put Norma Herr Center in the comment field. Also, if you're making the donation directly to YWCA, you make a check to YWCA and put that in the comment field so that we know, not just so we know, so that we know the money is going to that budget instead of all the other things that YWCA has done. So one thing that, I mean, I like a lot of things, okay, about the YWCA.
Second.
I'm sorry, what? Was there a question? Okay. One of the things, I forgot now what I was going to say. I not only was working on that summit in honor of a lifetime, but okay, pause. But the mission of YWCA, it's a little longer than this, but it's eliminating racism and empowering women. So really everything about the YWCA jives so much with my internal compass. It's a really exciting place to work. We have a lot of employee approval of it as a workplace. We've been growing with other organizations that share our values. So in the last year, we also merged with Cogswell Hall. I'm not sure if people are familiar with Cogswell Hall, but like YWCA, For more than a century, it was started by women in Cleveland to help other women, right? Just like Win. So, and around housing. So 3 years after the Civil War, I don't know what it was like to be a single mother, but YWCA's first projects were around housing women. And the first group was single mothers. So I don't know if part of that was widows from the war. I don't know why I don't know what it was like to be a single mother in 1868, and I don't know who those people were. But another population demographic were senior women. So there was some awfully named organization like the Home for Aged Protestant Women that became, I think, a Massa Stonehouse. So that's two different ways that we were housing women a century and a half ago. And Cogswell Hall was doing the same thing. YWCA also has a program called Independence Place and NIA, which go together. NIA stands for Nurturing Independence and Aspirations. And that's around housing 18 to 24-year-olds in permanent supportive housing. Cogswell Hall, on the other hand, does permanent supportive housing, but the population is a bit older and there are more folks who have disabilities there. And so that's a West Side permanent supportive housing project we have is Cogswell Hall that's been there for over a century, like I said. And then on the West Side, we have Independence Place for the young people. And those people are actually above our headquarters. So we have permanent supportive housing units above our headquarters on Prospect Avenue. And Nurturing Independence and Aspirations is the coaching aspect. So people aren't going to get kicked out there very easily. That's why it's permanent supportive housing. They can't even age out. They can be over 24, but eventually they don't want to live there anymore, right? They're ready to move on. And they don't have to participate in anything. But the coaches have to try to engage them in group activities and one-on-one case management and connecting them to resources out in the community. But they don't have to participate in any of that. But most of them volunteer to participate in case management. So those are some other ways that we are trying to prevent homelessness and address homelessness besides the shelter. And we have other programs that address homelessness as well, but I just wanted to give you a little taste. Go back. So the picture over here was our headquarters building. It's not the picture of Norma Herr, but I just wanted you to get a chance to ask. So that's our building on Prospect, and the upstairs are all apartments. There's a little gym, although it's off limits because of the pandemic, and there's a community room. So our lobby there functions as an apartment lobby in addition to an office lobby, and it's fully staffed since it's apartments. So we're open 24/7, 365, as is the shelter. So let's move on. So preventing homelessness, like I said, is part of how we express our mission. And our mission of eliminating racism and empowering women is the same mission as all the other YWCAs in the country, but we express our mission differently at each location. Part of the way that we express it is by ending youth homelessness and delivering powerful results. So we are very interested in measuring data and disaggregating data, but also the focus on youth homelessness doesn't just end with the permanent supportive housing that we have. There's another entity at YWCA called A Place for Me, and it's not a place. It's a place without walls and halls, is what they say. It is a organizational level collaboration with other agencies that serve homeless people experiencing homelessness and youth, where they're coming together to try to catch people falling through the cracks, to follow people. Oh, this person was at our shelter, then they left, we didn't hear from, oh, we heard from them. And then trying to really make youth homelessness brief and rare, which is what we think homelessness is in general. We think it should be brief, rare, and non-reoccurring. but especially for young people. So those apartments that we brought online above just celebrated a decade anniversary this year. And it was the first, I believe, in all of Ohio to address youth homelessness. I think I'll talk about that more later. Whoa, and it keeps going back to that slide. That's okay. Are there any questions about that while I find my place back in the slideshow? Okay, so you can find our new strategic plan on our website from our homepage. It has this beautiful graphic that I just had to use the entire graphic. Now I don't want to pause it because every time I pause it, it makes me start over. But I'm going to pause it anyways. We rewrote or recontextualized what our mission is, because our mission has been eliminating racism, empowering women, promoting peace, justice, freedom, and dignity for all. That is all the USA YWCA's same mission. And we all have the same branded colors. This is called persimmon, lest you think it's orange, okay? But you can see we reframed it here by spelling it out as the mission is eliminating racism and empowering women. Our vision, it says, is promoting peace, justice, freedom, and dignity for all. And then you have those three organizational values, which is racial equity and social justice. So we are an advocacy organization in addition to a service providing organization. A lot of people think we're just service providing charity, but charity goes hand in hand with justice, right? You gotta find out what's going on upstream. So there are ways for you to participate in our mission in this way. Starting March 1st is the third annual 21-day racial equity and social justice challenge that I urge you all to take part in. Thousands of people around the country did it last year, including many YWCAs in Ohio decided to launch at the same time as we did. And some of them customized their content. They used a lot of our content, but customized the content. So what happens is every week, we send you an email on a weekday, every weekday for 21 days in March. And you, what I call choose your own adventure, because that's how I'll see this year. But the last 2 years, we would send you maybe 3 pieces of content and you decide, do I want to look at this infographic, listen to this podcast, read a blog post, look at a report, look at a guide on how to do an analysis of your own organization or your family or your life, or how to stand up to racism. You choose your own adventure, and then you just reflect on it personally. And some organizations are using it as an organizational training tool. So my organization, every week on Friday, we're going to have a lunchtime conversation you can Zoom into to talk about, you know, what piece this week really hits you, or how do you see this playing out in your, or what was most surprising, or whatever. And corporations and nonprofits have been using it as organizational tools, but it's also written as a personal development tool. So I really encourage all of you to enroll in our free 21-day racial equity and social justice challenge that starts March 1st. So empowerment and economic advancement, health and safety, and then we added especially for women and girls of color. So we serve people of all genders. That's a misconception that people have, is that we're just for women or just for young women. But we want to be very clear that we are positioning women and girls of color as our primary audience, because there's many economic studies that show that promoting Black women, brown women, indigenous women, women of color, helps all women in terms of gender equity, right? And then helps all families, helps all nations, right? Is when you focus on the development of women, especially women who are marginalized by race and class. And then it goes on to explain some more, but it's just such a beautiful graphic. I really want you to look at it and think about on that graphic. Ooh, resume, yay, now I'm in the right place. So I talked to Pat about this, and I think she said it would be really good to share with you. The word guest. That is the word that we use to discuss who sleeps in the shelter, or who receives services from the shelter. And that is an expression of the dignity that we have, that people experiencing homelessness have, that we want to honor and respect. It also is a word of dignity in terms of race, equity, and inclusion as well. So we don't use the word client. We don't use the word customer. And we do use the word women, but I use guest more often when I'm being very conscious, because everyone does not identify as a woman. Now, everybody in the shelter has to be 18 years old or older, you know, and there are a lot of senior citizens in the shelter, which I think goes against people's expectations of who is experiencing homelessness. But everybody doesn't identify as a woman, but we're there to serve them. And the word guest also promotes a feeling of hospitality, because that's what we're doing. We're providing hospitality. You know, some women may have been in a correctional institution, and as they're re-entering society, they might be institutionalized in their mentality and their own feeling of self-worth, and feeling how people are going to treat them, at least what their expectations of how people will treat them. And we are very clear that we are not running a prison. You know, we have curfews, and the curfews have changed because of the pandemic several times. We have curfews, we have rules, but everyone is an adult and can make their own decision. And it's our job to give voice and choice to the people who are receiving shelter services. So guest is one of the words we use. So what would you call the people, do you think, who do the day-to-day operations in the shelter? What would that job description be called? Any guesses? Because I can't see the chat. But you could chat, you can put it in the chat and someone can tell me. Does anyone have any guess? What would you call the people who are going into the bedrooms, making sure people aren't in danger, making sure that there's peace, making sure people aren't sick and need attention, making sure there aren't, making sure we know how many people are in the building at any given time, who are serving the food, receiving the donations, running the front desk. Does anyone want to volunteer what that job description might be called at a shelter?
So I have, I put these in myself because I'm going on with your theme of guests. So either the concierge staff or the hospitality staff.
I like that, because you're taking the bait on the hospitality, and that is going down the right direction. A lot of other places might call them just shelter workers or monitors.
Advocates is one.
Advocate is what we call those people.
Oh, so look at that. Yes.
Most of the staff, I don't know if anyone would be tricked and think that's the word advocate, which is why I didn't mind putting it on there. But we also are emphasizing to our staff, because most of the staff at the shelter are advocates, that your job is called advocate, right? Like, yes, you have authority, but also your job is to empower the women in the shelter by providing those base services that a shelter provides. So how about people who help you get connected to resources, who might know your story more, might do that connection, might make a plan with you on how to get out of the shelter? What would you call those staff members if you were hiring?
Navigator.
That's true, but what's another word that you think people use in social services?
We have coaches.
Coaches,
yes.
That's an empowering word. And we do have coaches at Independence Place. Yeah, we have coaches. And is there another answer? No. Okay, so in a non-empowering place, you might hear case manager. But that means that a person is a case, or it can imply that. and that a person needs to be managed. And how empowering is that to be considered someone who needs to be managed, to be a client, to be a case, right? So we have what's called a housing navigator. And the whole goal is to get people on a plan to housing stability with a positive exit from shelter. So in the first year of operations, I think that's the right time period, but since we took over the shelter, the latest official data I saw was we have housed 300 people. All those people might not be in their own independent apartment or reunited with family in their own housing unit. It might be in a group home, might be to a nursing home, might be reuniting with family. But that's 300 positive exits. They weren't kicked out or we just lost them. Like we just don't know where they are. They didn't die, right? So those people are called housing navigators. And we emphasize to guests that your housing navigator's job is not to find you housing. It's to navigate you on your plan that you choose. They're not going to push you into a house either or an apartment. They're not going to make you sign any leases that you don't want to sign. Their job is to help you on your roadmap, help you plan your roadmap, you know, make the pit stops that you need to. Maybe you need to get connected to some counseling. Maybe you need to get connected to some groups. Maybe you need to get connected into some classes, some schooling, but that's your personal roadmap. And we're here to keep you on your plan, to help you make your plan. But it's also up to you to search for housing. It's a very difficult job to find adequate housing, but our navigators can only do too much. You have to own it yourself and empower yourself to find your housing, because that's a skill too. You're going to have to continue to use in life, right? And the last thing I'll put there is people-centered language. So you'll notice me, and then I'm going to use some quotes from NEOC, Northeast Ohio Coalition for the Homeless. We use a word called, or we use a phrase like people experiencing homelessness instead of homeless people. Right? That's a label. And if homelessness is a state that we think should be brief, rare, and non-recurring, there aren't such things as people, homeless people. It's not a static thing. And people have been labeled as a homeless person, especially if they are experiencing chronic homelessness, which means they've experienced many cases of homelessness or for a prolonged period of time. And so these are things that when I work with volunteers or outside organizations, I'm always very clear specifically around the word guest and people-centered language so that we're all on the same page. Because our mission isn't just to serve the guests, but also to advocate for our guests in the broader society. So that's why I wanted to share it with you, because sharing this language helps us all reframe how we're approaching things and approaching solutions to homelessness in a dignified way. So I just want to take a break, because I said I'd take a break after 20 minutes to see if, while we're recording this meeting right now, if anyone wanted to voice any topics that you wanted me to address, because I do have statistics about homelessness here that I can go through, but I also want to be responsive to my audience, because you all might be at different levels. You might, well, I understand what homelessness is like anyways, or what it's like to be in a shelter. So I can go down different paths. So does anyone want to?
Oh yeah, I want to say thank you, first of all, because I love the reframing in the language, because it gives an empowerment tool to people who are experiencing this, but it also gives those who want to help a different way of looking at it. And I love that you really talked a lot about that. Statistics are great. Stories are great. If you have some stories of women who you've seen rise up from this temporary condition and then into a better place, a better space. We do have a question that I'm going to read to you from the chat. And it says, why do some people seem to prefer remaining homeless, or am I mistaken?
Right. That's interesting, because that goes back to choice, right? So some people do choose to stay in shelter, or they choose to be unsheltered. I don't know 100% how much you can say their choice is rooted in freedom to choose. Because choosing housing stability in some ways is a privilege, right? So I have some slides on causes of homelessness, so we could talk about causes of homelessness. But I was thinking about doing this as a slide, so I'll just do it as a open popcorn. If anyone can suggest, some people prefer being unsheltered to sheltered, and that can be like that can be a real radical idea. So does anyone want to volunteer what you think would be reasons why people prefer to stay outside, unsheltered, instead of coming in the warm shelter that we provide 3 meals a day with a bed and a security guard?
They don't want to be monitored.
Yes, privacy is big. And not just from those who suffer from mental health paranoia, right? I mean, that is real. There are paranoid people out there. But your privacy, how many people want anyone else to know that they have experienced homelessness? And if you know the shelter is going to ask for your name, your first name and your last name, your prior address, who really wants the county to know? Because we're sharing that information with a county, a continuum of care across the county of everyone who's serving the homeless, with other shelters or people experiencing homelessness. Let me correct myself. We're working together. So who wants to share that information with the HMIS, the county system for tracking people? So privacy is big. And what if you've been incarcerated?
Right.
Or what if there's a warrant out for you? Mm-hmm. So privacy is big. Any other reasons?
We have a guess of the more obvious is mental illness, which is a lot of it. Mm-hmm.
Yeah, you might not actually want to be around other people, and not just from your paranoia, but you don't want to hurt them because you don't trust yourself because of your mental illness. Or you don't want them to hurt you because people who are experiencing mental illness are more likely to be victims of crime. Even though the dominant paradigm, the dominant message, the dominant narrative is to be afraid of people experiencing homelessness, that they're the thieves and the violent people. Really, they are more likely to be victims of violence themselves. So that it might be safer, really, and not just for your mental health. Or maybe people do really make you angry or agitated, so that's a mental health concern that would keep you out as well, let alone if you think people are out to get you because of some sort of paranoid something. So I just say independence. You have more independence if you're outside, and some people feel safer because there is a lot of theft in the shelter. You do get a locker, but people have their phone stolen all the time, or their purse, or you're responsible for your belongings, right? And some people have so many belongings, and they know we have a belongings limit. Maybe they can't afford a storage locker. Some of the people in the shelter pay rent for storage for when they're going to move out. They want to keep all their things. Some people would just rather keep all their things somewhere else, right? So there's a lot of independence by staying outside. And if people don't know where you are, I know people who prefer to be unsheltered, and it's because they know no one knows where this place is. It's my secret place.
So you approach these people, how would you convince them that the shelter is better than what they're doing?
Well, we're not doing that. The outreach primarily is by people like Northeast Ohio Coalition for the Homeless and Care Alliance. They go out under bridges, visit abandoned buildings, on the sides of roads, to do that outreach. And they did a lot of that during the pandemic. And even though they're a community organizing organization for people experiencing homelessness, they got into the business of temporary sheltering people at a hotel. There's an article about it in Freshwater. maybe Plain Press too. And Northeast Ohio Coalition for the Homeless has their own paper about them getting into the shelter business, which they're not in, but they sheltered people who were what we call shelter resistant, which is the hardest job of all. Metanoia is a winter only shelter, the Metanoia Project, and they also reach out to people who would prefer to be unsheltered, shelter resistant, and they do outreach to get people to come in. And that shelter is a night only, so it's no commitment. We're not taking your name, you know, but YWCA doesn't do the outreach so much from the shelter doesn't. A Place for Me does. We have youth workers who usually have experienced homelessness themselves, who actually do outreach to youth across different systems who may have fallen through the cracks, because people experiencing homelessness who are young are going to trust that person more. Right?
Well, and at least they have warming shelters for people that don't want to be a resident, right?
Right, and that's resident and tenant are also words that we don't use at the shelter. And partly too is it's not your place. This is the shelter's chair, the shelter's table, the shelter's bed. If we need to move you from this bed to make way for somebody else and put you on the top bunk somewhere else, it's not your bed. We didn't take your bed away from you. It's the shelter's. You're not a tenant here. You're not a resident here. Although people can use our address for their mail.
So what amazing positive stories have you for us that have happened, or what amazing negative ones have you had?
Oh, there are people, I've been there a year and a half. There are people who I've seen come back multiple times. There are people who we placed in housing, you know, we help place in housing, who have come back, that we have to turn away and say, you have an apartment, you know, or they've lost their apartment and they're going to be a guest again. So that's, I mean, that's some of the, and people who have been there the entire time I've worked there in the year and a half. So that, I mean, that's the negative side. Positive side, in that first year, we placed or assisted placing 300 people in housing. And during the pandemic, which wasn't the first year of our service, during the pandemic, we have continued to place people every month, even in March and April and May and June. And I just think that's incredible. The resiliency and the tenacity of my housing navigators. I mean, they are amazing. And, you know, one woman, hard worker, strong like a bull, would have like 2 jobs, work 3rd shift or swing shift. So that she'd be like missing the meals at the shelter, and it would have to get a special meal, or there'd be a conflict over I needed a meal because I have to sleep and I miss the shelter. You know, so many times she said, oh, I've got this apartment. And she had a language barrier, but she would have landlords who speak her language. Look, I've got this place, I'm moving in this day. So many times, maybe like 5 times. She lost the place like the day before she was supposed to move, because landlords might find someone else who can move in the day before, or might pay more, you know. She wasn't even, I don't think she was even going to get any subsidy. She was just working so hard and saving her money. Yeah, it's because there's such competition for housing, right? But she did eventually get housed, right? So there are plenty of people at the shelter who work. There's also plenty of people who have Social Security income, but it's very difficult to find a place that you can afford with your Social Security income that doesn't take your entire check. Right?
So are there commercial property owners that have ever offered to recreate one of their buildings into apartments for your cause?
Well, on NEAC's website, if you look at the 2019 statistics at the Northeast Ohio Coalition for the Homeless, if you look at the 2019 statistics, they said there were 710 units of affordable housing in Cuyahoga County. That must be private market. Must not be counting the public housing. But there is affordable housing, and my coworkers they go and take tours. The navigators, they go take tours of new places that are coming online, like St. Joseph Commons on West 25th Street. They built a brand new building with greater capacity. So we got, my coworkers got to tour it so that they can tell the guests, this new building, you know, it's on Euclid Avenue, it's on 25th. This is what the building's like. This is what's nearby, you know, that kind of thing. Because also during the pandemic, housing appointments get canceled. So you can't necessarily go see the apartment so much, or the interviews have been canceled because of the pandemic. I don't know how much of that has been done virtual, but despite those barriers, my navigators are housing people every month. You know, sometimes people are going to group homes. Sometimes when people get out, they get reunited with their children because they're separated from their children because they don't want their children in a family shelter, but they're experiencing homelessness. So they'll go to the shelter by themselves, save up their money until they can find a place where they can rent for 5 people, right? And get their stuff out of a friend's basement, a family member's basement, or whatever. People have been reunified with family members. People have been found to positively exit to group homes where they can get more support that they need. You know, nursing homes aren't for everyone, right? Who wants to be in a nursing home, but sometimes people need more support. They're not really capable of fully independent living. So yeah, lack of affordable housing is big. And if you know private landlords who have a unit or multiple units, you can connect them to me. I can give them to the supervisor of the housing navigator. Sometimes volunteers come in and they actually are landlords themselves on the side or as their main business, or their friend who they brought with them also has units, and they don't. They're an artist or something, but their friend that they brought for the barbecue does. And so I pass along that information to our my coworkers so they can have an ever expanding pool of more warm contacts than just what you might find online, which is limited. You know, because also not just online, but there's years waiting lists for vouchers. And then once you get a voucher to go to a private unit, the landlords don't necessarily take your voucher. It's income discrimination. City Council is working right now. Jenny Spencer is one of the Cleveland council members who is sponsoring legislation to ban source of income discrimination in the city of Cleveland. That's a big barrier, is source of income discrimination. So you can have a voucher and run out of time. It has a time limit to find someone who will accept your voucher. You know,
so Rachel, we've got about 5 minutes. There's a question in the chat that I want to get to. So the question is, do you get social workers' requests for placement homeless people when they've been treated in hospitals?
Hospitals will drop people off on our front door. Hospitals will call and say, so-and-so's here, she's ready to get discharged, and she wants to go to Norma Herr Women's Center. She probably doesn't want to go to Norma Herr's Women's Center, right? So so we do get phone calls from social workers. I was working 3rd shift at the beginning of the pandemic because we had a shortage of employees who could work during the pandemic, right at the beginning. So I was working 3rd shift at the front desk, and I got a phone call, 3 a.m. We need to discharge this person from whatever hospital. They'll hire an Uber and have the Uber driver drop them off. So yeah, exiting hospitals is a systemic problem. We cannot take care of people. We don't have medical capacity. So you have to be able to do what are your ADLs, which is your activities of daily living. So we try to screen for that when people come in, because there's a lot of like incontinence issues and stuff, but you have to be able to dress yourself, feed yourself, get out of your own bed. And the building has limited mobility options. There's only one floor has an elevator that goes up 4 steps. But the rest of the building is not physically able to handle like a wheelchair or a walker. So, but yeah, we are working with hospitals to try to create other solutions. We're on committees who are talking about the homelessness and hospitals connection.
So then what happens to those people that have wheelchairs and all that? What do you do with them?
Oh, there's people who have wheelchairs and walkers in the building. We prioritize having them be on the 1st floor, and we have to not put them in a top bunk.
Okay, so if you have to deny somebody accessibility, where do you refer them?
We try to give them a bus pass and a list of the other shelters, which is limited. There's limited. All the shelters are full. Yeah. Before the pandemic, during the pandemic, it's always an issue. There are not that many shelter beds.
We've got one more quick question, Rachel. Can you address how people experiencing homelessness are assigned to various centers or shelters?
How are they assigned? Everything comes through a county intake that frontline staff manage, but the county, like anyone who's experiencing homelessness, has to go through the county intake process first. So if you're a single adult woman, they're probably going to refer you to us. You know, if you're a family, they're going to try to refer you to a family shelter. That's the short answer.